Good morning. Today is a very special day. It's actually the World Autism Pride Day. And so, in honor of that day, we're speaking specifically on autism. Our topic today is Beyond Childhood, Lifelong Autism Support. Good morning, Dr. Okeowo. And it's a pleasure to have you with us today, Mrs. Olatunji.
Hi, Dr. Pamela. Such a privilege to be here.
So, Dr. Okeowo, I know you started, you're very interested in autism, and you started an autism foundation called Renewed Autism. But can we just go into discussing autism for the sake of our listeners who we've spoken about it several times, but may not know what it is? So, can you talk about what autism is and why it is important to recognize that autism is a lifelong condition and not just a childhood diagnosis?
Thank you, Dr. Pamela. Such a privilege to be here once again. So for the sake of our listeners, when it comes to autism is a neurodevelopmental condition and is characterized by certain signs and symptoms. So when it comes to autism, science is quite progressive. So we have people can have different definitions of what autism looks like, but we call it autism spectrum disorder. So that means that it's a spectrum. So they can have different, it can look different in different individuals. However, what are the characteristics that we look at? And a person, I don't want to say a child now because I'm talking about just adults and children. When it comes to challenges with communication, language, speech, and communication, also challenges in social interaction and behavioral challenges. However, these three components I've mentioned, the challenges may vary. So we can even have certain individuals who may not have communication issues, but they have challenges in these other areas, and they will still have a diagnosis of autism. So in summary, autism is a neurodevelopmental condition. So what's neurodevelopmental? What neurodevelopmental means that we have developmental milestones that we all go through from babyhood to adulthood, and we develop in stages. However, some people have delay or what we call a disorder in these developmental milestones. So that's where autism comes in, neurodevelopmental condition, and it is affecting or characterized by delay or disorder or challenges in speech, language, communication, social interaction, behavioral challenges, even learning challenges. So it can look different across board, but in summary, that's what autism is.
But why is it a lifelong condition and not just a childhood diagnosis?
To be honest with Dr. Pamela, I would like to approach the question in a different way. Personally, when I work with families or even when I work with professionals, I like to encourage them to look beyond the label and focus on the journey. For example, I have a book titled Embracing the Journey. It's a journey. And that is because, like I mentioned, neurodevelopment. So we all go through development all through our life. So when a child or a person is diagnosed, it's important to let the family know that it is a journey. So why I wouldn't say lifelong, let me clarify, is because science is progressive. And the truth is that there are certain interventions that were not available 10 years ago, that certain people couldn't access, that even when they become older, they can access and see marked improvement, even in some of the neurodevelopmental challenges we're seeing. So I like to give hope, not false hope, though. I like families to hold on to hope and believe and know that as they walk the journey, the level of improvement that we see, nobody can really ascertain. So when it comes to saying it's a lifelong condition, I personally, I wouldn't say maybe it's a yes or a no.
It is.
Sorry?
It's a lifelong condition. Whether it's good or it's bad or it's improved or it's not, I think the key of all the issue around this is to understand that it goes beyond childhood. Because a lot of people just, it is
Definitely.
just a childhood condition. And
No,
they need
it's
to
not.
realize
It's
it's
not.
not only children. That's, I think, is the essence of that question.
Oh, okay. I understand now that, it's not just going to stay in childhood. Those challenges will progress. But, I found something that sometimes some parents tend to settle. and feel like, okay, because this is there, there's nothing that can be done. So that's where I'm coming from. That to let people know that don't just say, okay, because they said it's
Don't just
life, I'm not going to put interventions. I'm not going to seek
stop it.
therapy. And
Yes.
I'm just going to settle. You understand? Yes. Let them know that this is a journey. And no matter what age, you still need to put in the work and see how the child goes. Yes.
Okay. So no, that's important. Thank you. So what would you say are the most overlooked needs of autistic individuals as they transition into adolescence and adulthood? So out of childhood, because we're talking about beyond childhood now. What are their the biggest needs?
What I've realized is that some of the things that are often overlooked are the importance of social interaction, also the impact of puberty in most of these individuals. So because I've worked with a family where the child was having challenges transitioning, the child was transitioning from puberty to adulthood, and the challenges they were facing, I could tell that puberty was playing a major role, because when it comes to puberty, the hormones and things like that. So sometimes people overlook some of those needs, the impact, and instead of tailoring and discussing with their providers or their therapists on how to put interventions in place to support the child, they were busy focusing on school and academics. So when it comes to things like the importance of social interaction, creating the right environment and supporting them to put that social system in place is often overlooked. The importance of even life skills, life skills are often overlooked because these individuals are going to grow up to adults, job readiness, integration into the society as adults, the need for maybe social interaction, creating social group and social peers. Those are often overlooked. The impact of puberty and adulthood and the impact it has on them both emotionally, in behavior. Remember, we mentioned they tend to have behavioral challenges already. Now when you add puberty on top and the hormonal interplay that often happen during puberty, so the emotional support, and of course we also know they have a risk of having anxiety, depression, at risk of things like that. So those things are often overlooked. Building a social network or providing that system for them is often overlooked. And like I mentioned, also job readiness, on how to because they're going to grow up into adult. We're going to talk about job readiness, integration into society, the life skills that they need. How do we begin to build independent skills rather than just focusing on academics? People tend to focus so much on academics. Even when it comes to language and communication, how can we integrate that for them to be able to connect and integrate into the society at large? So those are some of the things I feel that are often overlooked. The need to create social connections and interaction, the need for job readiness and preparation for life. What that may look like, of course, will be different. And also equipping with life skills and working with our professionals to help them to be more independent as much as possible. Those are some of the things that I feel are often overlooked.
Yes. No, I think definitely, as you've spoken now, and I think that's one of the reasons why we're having this discussion, so that people start thinking beyond childhood and looking at because I must say that there does seem to be almost an epidemic of autism. I do know of autistic families, of people with autistic children, but back then when we were young, they were few and far between. Now it's that almost every family has a child with neurodevelopmental disorder, whether you want to call it autism or you want to call it something else. But we see them so often now. And so it's so important that the parents, the grandparents, and people around understand it and are able to manage it and cope with it, whatever the cause is, because there's so many stories of thoughts about the causes of
so many ideologies.
It doesn't matter what the cause is. The fact is that the children have this problem, and we have
and
to
they need
know
support.
that they will grow to adults, find a way to help them cope. So, what kind of support systems do you think should be in place for teens and adults on the spectrum, socially, medically, and professionally?
Okay, thank you for that. So for socially, I talked about the need for social interaction. We are all social beings. So whether or not someone has neurodevelopmental challenges, we just now have to know how to create the right one for them. So socially, social peer group support. And I'm also aware that there are certain therapists or organizations that provide one-on-one services. They tend to also create, support group, of course, for people. Of course, these days, the online world, is part of our social world. So you can have peer-to-peer support group where families even come together now. And when they come together, they can also create, social peer group interaction. And of course, because the children may have similar needs, it's so easy to customize, the social group or the social interaction to suit these children. Also, recreational spaces. Recreational spaces. Sorry?
And medically?
Okay, and medically, we need to have more, clinicians, or would I say medical professionals who are trained to understand this condition and also how to support. And what I would really love to see, more training, in the mainstream system where even the first line providers, are able to identify this condition. Because some of the things we find is that not everyone is able to identify early in order to provide the right, direction or information. So that's why these days we are having, well, we say late onset diagnosis, certain people who have been manifesting maybe not the classical symptoms, but they are diagnosed late. So when we to have clinicians who are trained, who are better trained, in being able to identify and also being able to support. Also, more services medically, more services for these people, more clinics, more centers, to be able to provide support for adult individuals, or would I say even from teenage to adulthood, that can provide support for them lifelong, not just the childhood one that, is common.
Thank you very much. Thank you, Mrs. Olatunji, for coming on the program and sharing your experience with us. We really appreciate it. Can you share to us what your journey has been like raising a child with autism from diagnosis to where you are now? She's 23 or 25? How old is she now?
25. She's 25. She's 25.
Beautiful. So can you share with us your journey?
Okay, thank you. Thank you very much for having me here. And I would like to share some of our story. My daughter's name is Faizat. She's my first child and my only daughter. When she was an infant, she showed no interest in crawling. Her neck wasn't stable until after a year old. And she didn't start walking until after 2 years, even going to 3 years before she started walking. So we tried to enroll her into nursery school during that time when she was about going to 4 years, but she was rejected because she poo and wee all over her body every day. So when she couldn't communicate her needs or wants, and all this led to frequent tantrum during that time. She would display tantrum, and we tried a lot of herbal remedies. We tried giving her herbal remedies. We took her to different places for spiritual healing. All our effort during that time didn't work. So, and during that time, there was no awareness, nobody to tell us about autism. So we really thought it was spiritual. So we tried different places. We give her herbal concussions, but everything didn't work until we took her to psychiatric hospital, where she finally got diagnosed at the age of 11 years.
Oh, wow.
So when we took her to the psychiatric hospital, they introduced us to some different strategies to manage her condition, such as antipsychotic medications to manage her tantrums and aggression, because she will always scream or even bite herself until blood come out from her body. So the misconceptions in the neighborhood, the mockery, the stigma, and my husband was alive during that time.
Yeah.
So when we took her to the psychiatric hospital, they introduced us to different things, even therapy session. But unfortunately, around that time, when we were about to start helping our journey, my husband passed away. So things became so difficult for me. The responsibilities of taking care of my daughter alone with other two boys. I have 3 children. She's my first child, like I said earlier. So I couldn't afford to pay for a therapy session. That is number one. Also, I couldn't buy the antipsychotic medications. So things were so difficult. The journey became overwhelming for me alone, and my daughter's situation became so unbearable. We moved out from my husband's house during that time. We changed the location, but as we moved from one house to another, we moved from up to 4 houses here in Lagos before we could finally stay in one house at Iyanokwaja for almost 5 years because of the stigma and the mockery. Because the landlord will ask me to leave or to take my daughter to the psychiatric hospital or to take her to care homes. Because of her condition, she will always scream in the neighborhood. People will be like, isn't this a witchcraft? Take her to herbalist, take her to this, I had a lot of bad experience raising her, but I never give up. I continue with the journey. I said I will never give up on you, Faizat. Eventually, I started raising awareness on social media around 2021. Even during this journey, I got diagnosed of depression and anxiety in 2020. I ended up at psychiatric hospital too because of the situation. Things were so tough. I had to engage myself in different kind of jobs. I washed clothes for people. Life being a widow, also being a mom of an autistic child, it was so unbearable. Yes. I have to pay a lot of bills. And in our country, in underserved community, where there is no support for parents, no support for our children, people see us as burden, responsibilities. They move away from us. Nobody is ready to help. But when I started raising awareness, when I started sharing my story on social media, I met with a lot of kind-hearted people from different places, from different countries, even our autism community. So that reminded me that we are not alone. We have a lot of people in similar situations. So people supported me and they render help. I started paying for my daughter's therapy. Also, I was able to buy antipsychotic medication. If you could see her hand very clearly, you will see the scars, the marks, where she has beaten herself very well. When a mother could, as a mother, watching her going through those so much pain, I would, as a mother, how I would feel. Yes. Emotional experiences, overwhelming situation. Even when taking her out maybe for family functions, or maybe taking her to the hospital for an appointment. We booked for an Uber one day, and when the driver arrived, he looked at me and my daughter. I said, please unlock your door, we want to enter. As soon as I said that, he zoomed off immediately. I called his number, he didn't pick up. I now sent him text. I said, did you left because of my daughter? God will judge you. that statement really touched him. And he started calling me. I didn't pick up. I got so emotional that day.
Wow.
I left that spot entering public bus. So even in public bus, there was a day I entered public bus with my daughter. The conductor looked at my daughter and said, why is he screaming? Why is she screaming like a goat? Oh, yeah, madam, calm down. But the passengers are scared. They are scared of your daughter. You better calm down. Life, raising a child with autism in Nigeria is so difficult. And this is why, with my experience and my professional skills, because to increase my knowledge, I decided to pursue the IBCCES certification some months ago. So I'm now a special needs therapist. With my experience and my professional skill, I started the foundation in her name to help more families in similar situations, more families that are still struggling, going through so much pain. And we launched the foundation in around April 19th. So we invited 20 parents, 20 parents with their children. We gave them, we shared gifts. We had a workshop, training for parents, and also television. They were there.
You've spoken about your journey, and I really appreciate your sharing the pain with us. And nobody can do better than you can. So can you just give us right now your phone number, just in case anybody who's listening wants to support you and your foundation? Can you just give us a number they can contact you on?
Okay, I have two numbers. So
Just
one is still working for. Okay, is 090 27 81 34 27.
Perfect.
Is 090 27 81 34 27. They can reach me on it through WhatsApp. Also, they can call me on the number. Thank you.
Thank you very much. So if I can just jump back to Dr. Okeowo, you've heard the trials that Mrs. Olatunji has gone through. Her daughter's 25 and she still has, she's really rallied around. It's been tremendous, the work that she's doing. Can you then tell us, we had talked about the kind of systems you think, we don't have much time, should be in place professionally for such children going into adulthood and as adults? And how does your foundation help to bridge that gap, the gap between pediatric and adult services for autistic individuals?
Okay, thank you, Dr. Pamela. And of course, I want to celebrate Mrs. Olatunji. She's done really well, in supporting her daughter thus far. So at our foundation, we work partner with caregivers, families, and also professionals on how they can support, children with autism as they transition into adulthood, both young adults and as they go into adulthood. Some of the things we do, we have parent coaching, where we coach parents on how they can create the right environment for their children. For example, Mr. Latin talked about her daughter being hitting herself at one point. Sometimes what we find, some children have auditory hypersensitivity. So the environment may be overstimulating, overwhelming for the child. So we work with parents on how they can create an inclusive home environment to help support their children. Other things that we do is that we support them on how they can begin to build independent life skills. Remember, we talked about as they grow into adulthood, there are certain skills that these children need. Also, we work with them on how they can effectively partner with their professionals, how they can know what effective therapy should look like, how they can advocate for their children, both in educational sector and even working with professionals, and what they should demand for. We work with them to ensure that all these are in place, to know effective therapy, what to ask for, how to partner effectively with schools and the medical professionals that they have in their environment, and what that looks like. Also, we point them in the right direction depending on their location, where they reside. Okay, the kind of educational services or services that are available in that environment for special needs children, and the kind of professionals that work with such children in the environment and locality they are in.
Okay, thank you. Unfortunately, time is already gone. Do you have a number that people can reach you on if they're interested in contacting you? And you have just 1 minute. Last word for our listeners.
Okay. You can contact me at autismrenewed@gmail.com. autismrenewed@gmail.com. Okay. The number that I have, I think it's a foreign number.
Last words for us.
Okay, last word for our listeners. I just want, because I know our listeners, we have speaking to the whole public. This, we all have to work collectively to support families, to support caregivers who have children with special needs, particularly with autism. So I think it's important for us all to get knowledge and to avoid stigmatization. Even if you don't understand, you need to ask questions. Let's get knowledge, provide love, empathy, and understanding, and know that these parents and families are doing a lot. So the least we can do is to provide them with support, with love, and with encouragement. And to medical professionals and educators who are doing a fantastic job, I want to say well done, and let's keep supporting these families and giving them our best. Thank you. Thank you once again, Dr. Pamela, for having me.
Very much for coming on the program. Thank you, Mrs. Olatunji. And I want to say a special thank you to all those people who are out there supporting people and individuals living with autism. Thank you.
Thank you for watching. Please like, share, and subscribe for new video updates.